my name is Siobhan McKenna, and I'm an occupational therapist at Burke Rehab Hospital. Today I'm going to be discussing bowel management within the scope of occupational therapy. I'm going to be discussing task demands that we work on within therapy, as well as various positions that one might be in order to complete the bowel program. I'm also going to be discussing various equipment that one might utilize in order to decrease the amount of assistance required from a caregiver, while also maximizing independence for your loved one. Task demands. Upright tolerance is a component of the bowel program that's necessary in order to complete it sitting upright on a commode or a toilet. So that's something we're working on quite a bit within therapy. Sometimes we'll notice that patients become lightheaded or dizzy or have an increased level of fatigue when sitting upright for a long period of time. So within therapy, we're working on that upright tolerance to ultimately be able to perform that bowel program on the commode. We're also working on upper extremity functioning. So is your loved one able to reach back in order to perform toileting hygiene? Are they able to manipulate clothing to perform clothing management? These are all things that we're working on in therapy. We're also looking at their fine motor coordination and their prehension skills. So are they able to manipulate medication in order to insert a suppository? Are they able to utilize their fingers to perform digital stimulation? We're working at this at the prerequisite level as well as in the real context, so sitting on a commode and actually performing the clothing management with them. Now, if this is something that they require assistance with, this may be a role for you to perform within the bowel program. Positioning. So when your loved one first comes to Burke Rehabilitation Hospital, we might start the bowel program laying down in bed. This is because we're still building on their upright tolerance. But as they improve in their upright tolerance, we're going to start transitioning them to sitting upright on a commode or on a toilet seat. If it's the case that we recommend they continue to perform the bowel program laying down, then we would just recommend that they perform this laying on their left side. Now, the reason for this is that it allows for your bowels to empty more fully through the transverse and the descending colon. So as your loved one improves in their upright tolerance, we're going to start transitioning them to performing the bowel program on a commode. Now, there's a various amount of commodes out there, so I want to take some time to describe and differentiate between a few. First is the standard commode, which is what you're probably the most familiar with. This is just a regular plastic commode that can be positioned bedside or directly over the toilet. The standard commode could also be in bariatric form, which allows for a wider space as well as a higher weight capacity. Next is the padded drop arm commode. So what's nice about this is that the arm rest of the commode could be dropped down on either side and allow for more space for your loved one to transfer from one surface to another, rather than attempting to clear their hips over that armrest. Another component of the padded commode is that padded portion. So this can be especially helpful if your loved one has a wound on their sacrum or is at a higher likelihood of skin breakdown. Next, you'll see the tilt in space drop arm commode. This includes a rolling component, which has brakes on it, so that way you can lock it into place at whatever desired location you have, as well as the tilt in space component. So if your loved one has an increased level of fatigue or might feel lightheaded when sitting upright for a long period of time, you have the ability to recline them back, so that way they're still performing it more upright compared to laying in bed. Next is a rolling commode that can also be utilized as a shower chair. So what's nice about this is that following the completion of the bowel program, you can then directly roll your loved one into the shower to perform bathing, which would save time and energy for the toileting hygiene component of the bowel program. Next is the raised toilet seat. So this also comes in a lot of different shapes and forms. It can come with and without armrests. As you can see here, this one has armrests. And it can come in different sizes, so from 1 inch to 5 inches. And this can ease the transfer from providing your loved one with a higher height and also decrease the amount of assistance required from you as a caregiver. Clothing management is another big component of the bowel program. Now, this can be performed at bed level or seated upright on the commode or toilet seat. If your loved one is performing the clothing management sitting on the commode or toilet, we would recommend that they shift their body weight side to side to clear their hips and then pull the pants down or up. They could also perform a depression lift where they rely more so on their hands to clear their hips, and then you may be assisting as a caregiver to pull the pants up or down. Now, if this is requiring too much assistance from you as a caregiver or requires too much energy or time for your loved one, you could also perform this on the bed. If that's the case, we would just recommend that your loved one roll side to side in order to clear the hips and pull the pants down. If it's the case that your loved one is performing clothing management at bed level, we would then recommend that you perform either a Hoyer transfer or a depression lift transfer to the wheelchair. So now transfers. These are very important in order to complete the Bowel program. I'm going to describe a few different transfers to just differentiate them, because depending on the level of assistance required for your loved one to complete a transfer, we may recommend one versus another. First is the transfer board technique, in which you'd be placing a wooden or plastic board underneath the thigh of your loved one to bridge a gap between one space over another. Next is the modified squat pivot transfer, which is exactly like it sounds. Instead of coming fully upright to a stand, your loved one would maintain a squatted position to then pivot over to either a wheelchair, a toilet seat, or a bed. We also perform depression lift transfers, which relies a little bit more on your arms to push yourself up into the air and transfer to another surface. And next we have the mechanical Hoyer lift. If your loved one requires more assistance from you as a caregiver, this may be a better option. This allows you to place a sling under your loved one to then hoist them up with the mechanical lift to then transfer them to another surface. This would require the assistance of 2 people to complete. There are other transfer techniques such as the Rifton that we could utilize to transition from one position to another. In addition to the durable medical equipment such as the commode, there's also adaptive equipment that we utilize for patients that may have a lack of hand movement. So if your loved one can't actively move their hands or manipulate objects because of decreased fine motor coordination, these tools may be helpful for them. Here you'll see the suppository inserter as well as the digital bowel stimulator, which could be utilized to perform these techniques without assistance from you as a caregiver. In addition to the adaptive equipment, we also have bowel aids that can be utilized for toileting hygiene. So if your loved one doesn't have the functional reach to reach back and perform the hygiene themselves, this could be a good option for them. Sometimes patients also prefer the use of a bidet to allow for them to perform the toileting hygiene on their own. And like I had mentioned before, performing bathing following the completion of the Bowel program can also be helpful by saving time as well as energy. And finally, I want to address the program within the community. You want to make sure that if you are going out in the community, you're practicing good hand hygiene, and you want your loved one to wear the appropriate clothing, whether it's looser pants or maybe dresses, to allow for decreased assistance from you as a caregiver while also maximizing on their independence. But if there's one thing to take from this presentation, it's to follow a schedule. By following a routine and performing the program every day at the same time, you're ensuring success within the program.